platform. It's Earth Talks for Earth Day at Discovery Green Park. Come on down, come on up, come on over. Right here behind the big astronaut. Our next speaker is a tropical disease expert, Dr. Peter Hotez. He's going to be speaking on poverty, climate change, and our hidden diseases of the poor. Dr. Hotez is the Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine. He's the director of the Texas Children's Center for Vaccine Development. He's the endowed chair of Tropical Pediatrics. He's a fellow in disease and poverty at the James A. Baker Institute for Public Policy at Rice. Is that enough? Grab a seat. Get on over here. He's also the author of the acclaimed book, Forgotten People, Forgotten Diseases, and hot off the press, Blue Marble Health, an innovative plan to fight diseases of the poor amid wealth. Please welcome to this Earth Talk, Dr. Peter Hotez.
Well, thank you. Thank you so much for coming out this afternoon. We're a small but enthusiastic group here. Excellent.
Yeah, just
can everybody hear me okay? Fantastic.
Treat it like an ice cream cone.
So I'm going to give some abbreviated remarks this afternoon. And it's really quite an interesting story. We have a group of around 50 scientists that are committed to diseases of the poorest people in low and middle income countries of Africa, Asia, and Latin America. And we're building next generation technologies to combat these diseases. And so the interesting story is that we've been taking on these neglected tropical diseases, and I sometimes like to call them the most important diseases that you've never heard of. They include diseases like Chagas disease and schistosomiasis and hookworm infection and ascariasis, trichuriasis, leishmaniasis. You might not have heard of them, but they're actually the most common afflictions of people who live in poverty. And in fact, every single person who lives in extreme poverty has at least one of these neglected tropical diseases. And there's an interesting feature about them, which is that they both occur in the setting of poverty, but they actually cause poverty. They cause poverty because they're chronic and debilitating conditions that make people too sick to go to work. They are diseases that actually shave IQ points off of kids, so it thwarts child development and interferes with pregnancy. And we can show that these are the diseases that trap people in poverty. There's a term out there called the bottom billion. It refers to the fact that there's 1 billion people in the world that live on no money. And in fact, these are major reasons why people cannot escape poverty, because of all of these poverty-promoting effects. We have a group of around 50 scientists that were working in Washington, D.C., and about 7 years ago, we relocated to the Texas Medical Center, to Baylor College of Medicine and Texas Children's Hospital. We're also linked with Rice University. And we set up because of the horsepower of the Texas Medical Center, the world's largest medical center, where there's enormous resources and scientific expertise. It was a great place to build our National School of Tropical Medicine. But then we got a surprise, and the surprise was we started looking around in Houston, also in South Texas, southeastern Texas, in the adjacent states of Louisiana and New Mexico, and we were troubled to find a depth and breadth of poverty and environmental degradation that we had no idea existed in America. And when we then realized that there were about 5 million Texans that live below the poverty line, and altogether on the Gulf Coast states, there are around 10 million people. So of the population of the Gulf Coast, there are approximately 60 million people. about 16% or 10 million people live in extreme poverty. And we knew from our work in Africa and Asia and Latin America that poverty, together with environmental degradation, are major determinants of the rise of these tropical infections, these neglected tropical diseases. So we did something quite interesting, is that we flipped that global health lens inward and started seeing diseases here that no one knew existed. So let me give you an example. We started working in rural Alabama, and we found a significant level of human hookworm infection among the poor living in unincorporated rural areas where there was an absence of sewage and absence of environmental control. Hookworm infection is a parasitic worm infection. It causes anemia, blood loss. It's the major scourge of places like India and Uganda. And here we had it right here in rural Alabama. And we believe it's all over the South. We believe it's in Mississippi, Louisiana, and East Texas. It's just that nobody's been looking. Another example is another parasitic. A lot of these are parasitic diseases. Another one is called toxocariasis. These are not, I know these are names that don't exactly roll off the tongue, but toxocariasis is a parasitic worm infection that's transmitted from stray dogs and cats. And when we would drive around places like Acres Home or the 5th Ward of Houston, we would see packs of stray dogs, cats, and we knew that there was a high likelihood that we would find this disease. So what happens is 100% of those stray dogs and cats are infected with these toxicara worms. They're defecating indiscriminately on playgrounds and sandboxes, and kids in poor neighborhoods are coming into contact with them. And we're now finding about 20% of those kids are infected. And this is a disease that's been linked to developmental delays, to seizures. So we think this could be an important reason why socioeconomically disadvantaged kids don't do as well on tests of school achievement and educational attainment as kids of higher socioeconomic status. It's actually due to the presence of these parasitic worms, this disease called toxocariasis. Another example is Chagas disease, which is a parasitic infection of the heart that causes a debilitating heart disease. We started identifying these individuals because they would try to donate blood to the Gulf Coast Regional Blood Bank. They were tested for Chagas disease, told they might have the infection, and they should visit their primary care provider, which they did, and their primary care provider invariably said, "Oh, that must be a false positive, because we don't have that disease here in Texas." Well, we do. We estimate there's over 30,000 cases of Chagas disease here in Texas, and not necessarily immigration across the southern border, because we're finding about 10% of the dogs are infected in Texas as well. So the dogs are not slipping in across the border from El Salvador and Mexico. We actually have transmission of these diseases here in the state of Texas. And then the list goes on. We have typhus. We have all of the ingredients necessary to ensure that we have dengue fever transmission or Zika virus infection, which we've had in South Texas for the last 2 years. So the point is, these neglected tropical diseases are widespread in the state of Texas. They're widespread on the Gulf Coast of the United States. They're not even rare diseases. We estimate around 3 to 4 million people in the Gulf Coast states are affected by one or more of these neglected tropical diseases. And again, they're debilitating and poverty promoting. The problem is they fall through the cracks, and they fall through the cracks in an interesting way. So, for instance, the Bill and Melinda Gates Foundation, which has done so much for global health, has no interest in diseases of the United States. So therefore, something like the Gates Foundation is not taking them on. And it's also kind of curious when we apply for grants, for instance, from the National Institutes of Health to study these diseases, we often get turned down because they say what we're doing is not necessarily innovative. We're doing old-fashioned epidemic and outbreak investigation to try to actually uncover the full extent of these diseases. It's not necessarily innovative, but it's absolutely necessary. So as a result, we're trying to get our arms around the full extent of this problem really taking this on as a signature program now of our National School of Tropical Medicine to really uncover the full extent of these 3 to 4 million Americans living in the Gulf Coast states, in Texas, Louisiana, Alabama, Mississippi, and Florida, to uncover the full extent of these poverty-promoting diseases. We're now had some positive. We've made some positive progress lately working with the U.S. Congress. So we've been working now with Congresswoman Sheila Jackson Lee, together with a Republican member of the House of Representatives, Chris Smith in New Jersey, and we've gotten now Senator Cory Booker to take an interest in these diseases, to introduce legislation to really work hard to uncover the full extent of these diseases in the Gulf Coast states, identify exactly how they're transmitted, but most importantly, now working to prevent them. One of the big barriers that we have, our healthcare providers have so little understanding of these diseases. We don't teach these diseases in schools of medicine and nursing schools, so there's a lack of awareness even among physicians and other healthcare providers. So our School of Tropical Medicine now is providing training to recognize these diseases. And lastly, we need new technologies. Unfortunately, some of the diagnostic tests for these diseases were developed 50, 60 years ago, these very old-fashioned technologies, and they're not easily accessible. So that for instance, when you go visit your physician or healthcare provider and that individual wants you to get blood work done, they give you a little slip from Quest Diagnostics with a little box to check for blood chemistries, for blood glucose, for your blood counts. There's no box to check for diagnosing these diseases. So we're trying to make simple-to-use diagnostic tests. And finally, we're making next-generation drugs and vaccines for these diseases. We've had great success raising awareness about neglected tropical diseases in far-off Africa, Asia, and Latin America. But it's curious how now, for the last 7 years, we've been finding these diseases are widespread in the state of Texas in association with poverty and environmental degradation, and it's been very challenging to raise awareness about these conditions. So I do appreciate the time you've taken to listen about these diseases, and if you have follow-up questions or want to visit us at our National School of Tropical Medicine, we're at Baylor College of Medicine and the Texas Medical Center. So thank you so much.
Go away. They've
Okay.
got something for
Okay.
you.
Dr. Peter Hotez, y'all. Asha from the Citizens Environmental Coalition has a little something for Dr.
Oh, thank you
Hotez.
very much.
Thank you.
Thank you. Very
This
nice.
is